Hi everybody, this is Dr. Henson. I wanted to make a little video. I had an interesting case last week I thought that really highlights what applied kinesiology is capable of helping patients with, and sometimes finding contributors to a problem that you normally would never make a connection with. So I had this young lady come into the office last week, and she was complaining of really bad low back pain on her left side, and pain that would go down her leg and into her big toe. And the big toe was going numb, and so when she tried to run, it only got worse. So we did a applied kinesiology examination where we tested various muscles of her pelvis and her lower leg and her foot and ankle area. And one interesting finding, besides she had several things off in her pelvis, but also several things in the foot, several bones in the foot, even though she wasn't complaining of any pain there, several bones were misaligned that were also contributing to some of the dysfunction in her hip. So every time she was taking a step, because of those subluxations or misaligned joints in her foot, her brain was getting incorrect information and not turning on muscles, properly when she walked. But one finding that you won't see very often, and actually in her case, because of some of the things that she's dealing with, one of the things that came up as a contributor to her problem was her first rib. So in essence, the first rib on both sides, both here and there, were misaligned in such a way that they were actually short-circuiting muscles in her pelvis. And so after correcting both of those ribs, that really helped her make take a big step in her progress of getting better. And so the cool thing about applied kinesiology is that, one, sometimes you're going to find things that are very near the area of complaint. You'll find things that are far away from the area of complaint that are contributing to the problem, and sometimes you'll just see really bizarre things. But when I see first ribs like that on her, or in anyone for that matter, usually that's indicative of some sort of an endocrine imbalance. And in her particular case, a lot of the muscles that are associated with her ovaries and her uterus were malfunctioning, and those muscles stabilize the pelvis. So it's usually your butt muscle, or a couple of the other muscles that stabilize that area. So anyway, I thought that would be interesting to share. And if you have any questions about that, just give me a shout. You can message me or private message me. But that's why I love situations like that, because it really shows you how AK can find things that you just wouldn't find any other way. Anyway, I hope that is informative. Hope you enjoyed that. We'll talk to you again later. Bye.